Aphorism 182. Thus, the imperfect selection of the medicament, which was in this case almost inevitable, owing to the too limited number of the symptoms present, serves to complete the display of the symptoms of the disease and in this way facilitates the discovery of a second, more accurately suitable homeopathic medicine. Explanation. In this aphorism, Dr. Henneman has given idea about symptoms of one-sided diseases. In one-sided disease, because of too limited symptoms of the disease, selection of the medicine is imperfect, and that happens certainly. We can't avoid this situation, but this imperfectly chosen remedy serves to complete the display of the symptoms of the disease by producing accessory symptoms. In this way, it facilitates the discovery of the second, more accurately suitable homeopathic medicine. Aphorism 183. Whenever, therefore, the dose of the first medicine ceases to have a beneficial effect if the newly developed symptoms do not, by reason of their gravity, demand more speedy aid, which, however, from the minuteness of the dose of homeopathic medicine and in very chronic diseases is excessively rare. A new examination of the disease must be instituted, the status morbi, as it now is selected in accordance with it, which shall exactly suit the present state, and one which shall be all the more appropriate can then be found as the group of symptoms has become larger and more complete. Explanation. In this aphorism, Dr. Henneman has given idea about selection of second remedy. When the dose of the first medicine stop to give further beneficial effects, and if newly developed symptoms do not demand any speedy aid, means if newly developed symptoms are mild in their intensity, which is mostly due to minuteness of the dose, then a new examination of the disease, all the signs and symptoms of the disease must be done. Present picture of the disease should be noted down, and second homeopathic remedy should be selected accordingly. This remedy shall exactly suit the present state of the disease. The remedy shall be found more appropriate as the group of symptoms has become larger and picture of the disease more complete. Footnote 112. In cases where the patient, which however happens excessively seldom in chronic but not infrequently in acute diseases, feels very ill, although his symptoms are very indistinct, so that this state may be attributed more to the benumbed state of the nerves, which does not permit the patient's pain and sufferings to be distinctly perceived. This torpor of the internal sensibility is removed by opium, and in its secondary action, the symptoms of the disease become distinctly apparent. Explanation of footnote 112. It rarely happens with the chronic disease, but commonly in acute diseases, that patient feels very ill or sick, even though his symptoms are not indistinct or clear. Such a state may be attributed more to the benumbed state of the nerves, which does not allow the patient to perceive the symptoms, his pain and suffering. This inactive internal sensibility is removed by opium. In secondary action of opium, the symptoms of the disease will become distinctly apparent, can be clearly pursued by the patient.